Visual acuity testing. Check the patient's electronic health record to understand the reason for their visit. Take note of any past history of visual conditions. Obtain and disinfect the eye occluder if it isn't disposable. Verify the Snellen eye chart is appropriate for the patient you're assessing. Secure it in a 20-foot area that's well lit and free of obstacles. Greet the patient, identify yourself, and state your name, title, and the provider you work with. Confirm patient identification using 2 identifiers. Perform hand hygiene. Explain the procedure and the rationale for the procedure. Use terms that the patient can understand. Provide the patient with an opportunity to ask questions. Direct the patient to stand on a mark on the floor that's 20 feet from the Snellen chart. To properly administer a visual acuity screening, you need to ask the patient if they wear corrective lenses or contacts, and when they last saw an eye specialist. Record the date of the patient's last eye exam. Hold the occluder by the handle and don't touch any portion of it that will touch the patient's eye. Pass it to the patient. The standard distance for the Snellen eye chart is 20 feet for the screenings. The documentation is reflective in a fraction. The distance is the numerator, and the denominator is what distance a person with normal vision could correctly read on the same line. A patient with 20/20 vision is able to see at 20 feet what a person who has average vision sees at 20 feet. This is normal vision. If a patient has 20/40 vision, the patient can see at 20 feet what a person who has average vision is able to see at 40 feet.
All right, I'm gonna have you go ahead and stand up straight. Make sure you don't squint. Does this look like it's at eye level? Okay, good.
Instruct the patient to lightly cover their left eye with the occluder, but still keep it open. Closing or putting pressure on the eye not undergoing testing may result in squinting of the eye that you're testing. That interferes with focusing when switching eyes, which can affect the accuracy of the results. Pointing to the 20/70 line, look at the patient and instruct them to read the letters in that line, observing their stance and actions. If the patient is unable to read the 20/70 line, ask them what line they feel they can read above it. The patient should begin reading with that line. Continue the process of moving down the chart, pointing to the lines in sequential order. Ask the patient to read each line until the patient inaccurately identifies a letter. The line above where the error occurs is the result for the right eye. However, please follow your office policy. Document your findings. Ask the patient to move the occluder to the right eye and remind the patient to keep both eyes open throughout testing. Repeat the process while observing the patient. Again, the patient should continue moving down the chart, reading each line until misidentifying a letter.
Now.
Document the line without an error as the patient's visual acuity in the left eye. Ask the patient to remove the occluder and repeat the process, having them view the chart with both eyes open.
Now.
Note the line where there are no errors as the visual acuity in both eyes. If office policy, after finishing the letter recognition process, point to the colored lines and ask the patient to identify the colors. Complete the procedure by disinfecting the occluder or dispose of if it is disposable. Document the procedure and the results in the patient's electronic health record. Note the status of corrective lenses, the color screening if appropriate, and any patient observations or comments that may have an influence on the results. Warm eye irrigation. Check the patient's electronic health record to understand the reason for their visit, taking note of the provider's orders. Perform hand hygiene. When assembling your equipment, secure 2 irrigation sets if you're irrigating both of the patient's eyes. Gather additional supplies, including a collection basin for the solution, gauze to use on the patient's eyelids before and after the procedure, a drape to protect the patient's clothing, and a bath thermometer to measure the temperature of the warming solution. The provider will specify the name of the solution, its strength, the time you're to give it, and the route of administration. When retrieving it from the storage area, confirm the information on the solution matches the order. Take an extra step to examine the expiration date. Prior to the procedure, prepare a basin of warm water. The temperature should be around 98.6 degrees Fahrenheit, or 37 degrees Celsius. Use a bath thermometer to check the temperature. Recheck the label of the irrigation solution for a second time, comparing to the order. Then, submerge it in the basin of warm water, protecting the label. Remove the solution from the container and dry the bottle off. Confirm the correct solution for a third time and place multiple gauze pads, a drape sheet, a collection basin, and warm solution on a tray to transport to the exam room. Greet the patient, identify yourself, and state your name, title, and the provider you work with. Verify the patient by using 2 identifiers. Ask the patient to identify any history of medication allergies. Explain the procedure and ask the patient if they have any questions. Gain consent to touch the patient's eye and perform the procedure. If the patient is wearing glasses, have them remove them. Remember to ask them if they're wearing contacts. If so, ask them to remove them. Ask the patient if they'd like to sit or lie down during the procedure. Position the patient based on their preference, in either a sitting or supine position. Perform hand hygiene and apply non-sterile gloves. Use a drape to cover the patient's shoulder on the side you're irrigating. Moisten a gauze pad with the irrigation solution. Wipe from the patient's inner canthus to the outer canthus, or from the nose outward. Discard the gauze after 1 use. Repeat the process with a new gauze pad until it's free of any dirt or debris. Have the patient turn their head to the side during irrigation. Place a collection basin below their eye and ask the patient to hold the basin tightly against their face and to keep both eyes open looking straight ahead, focusing on a non-moving object. Using fingers on your non-dominant hand, pull upward on the patient's upper lid and downward on the patient's lower lid. Hold their eye open and maintain this position throughout the irrigation. Use your dominant hand to hold the bottle of irrigation solution about 1 inch above the eye and near the nose. Begin squeezing the bottle, pointing it towards the lower conjunctiva to allow a steady stream of solution to flow from the patient's inner to outer canthus. Continue squeezing the bottle until the solution is gone, you achieve the desired effect, or the patient is unable to tolerate the procedure. Remove the basin, taking care not to spill the solution. Using clean gauze, wipe the patient's eye from the inner to the outer canthus, discarding it after use. Continue the process until the patient's eye is dry and there's no debris on the gauze. Provide the patient with a towel to dry any other areas that may have become wet during the procedure, and assist them to a comfortable position. Examine the solution for any debris, making a mental note when documenting the procedure. Dispose of trash in proper trash receptacle. Remove gloves and perform hand hygiene. Document the procedure, identifying the date, time, solution, strength, amount used, eye irrigated, patient position, and tolerance and observations of the discarded solution, along with any comments shared by the patient. Perform ear irrigation. Check the patient's electronic health record to understand the reason for their visit. Take note of the provider's orders. Perform hand hygiene. Assemble equipment and supplies. Compare the information on the label with the information in the provider's order, which includes the name of the solution, the strength, the time you're to give it, and the route of administration. Take an extra step to examine the expiration date. Prior to the procedure, prepare a basin of warm water. Confirm that the temperature is 98.6 degrees Fahrenheit using a bath thermometer. Recheck the label of the irrigation solution to the provider's order for a second time, checking the rights that were examined during the first check. Then, submerge the bottle of solution in the basin of warm water, protecting the label, and allow it to sit in the solution a few minutes. Remove the solution from the container of warm water and dry the bottle off. Remove the cap of the solution bottle, laying it on a flat surface. Be sure not to touch the inside of the cap. Grasp the bottle with the label facing upwards. Your palm should cover the label. Pour the ordered amount of solution into the ear wash spray bottle. Recap the solution bottle and set aside if any solution is left. Confirm the correct solution for a third time against the order. Place waterproof drape, multiple gauze pads, an ear basin, a couple of cotton balls, and ear wash spray bottle filled with warmed solution on a tray to transport to the exam room. Greet the patient, identify yourself, and state your name and title along with the provider you work with. Confirm patient identification using 2 identifiers. Ask the patient to identify any history of medication allergies. Explain the procedure. Ask the patient if they have any questions. Obtain consent to touch the patient's ear and to perform the procedure. Perform hand hygiene and apply gloves. Position the patient in a sitting position. Place a waterproof drape over the patient's shoulder on the side that you'll irrigate. If your facility policy allows, use an otoscope and pull the pinna of the patient's ear up and back, gently inserting the speculum. Pay attention to any obstructions or blockages from foreign bodies or cerumen. Spray enough irrigation solution onto a gauze pad to moisten it, then cleanse the patient's outer ear. Instruct the patient to tilt their head towards the side you're irrigating. Place the earwash basin tightly below the ear and ask the patient to hold it in place. Grasp the spray bottle in your dominant hand and the disposable tip in your non-dominant hand. Insert the tip into the patient's ear, positioning it towards the top of the ear canal. Begin spraying the solution, keeping a moderate stream flowing. Take care not to let the tubing kink or bend. Monitor the patient for tolerance and the solution for expelled debris. Ask the patient to alert you if they feel discomfort, feel dizzy, or experience a burning sensation. Once you have used all solution or obtained the desired results, remove the disposable tip from the patient's ear and allow the residual solution to drain. Remove basin from the patient and insert a cotton ball loosely. Place a waterproof drape on the exam table and have the patient lie on their affected side for 15 minutes. Dry the outside of their ear with gauze and inspect it using an otoscope with a disposable speculum. The provider will recheck the patient's ear and determine if any additional treatment or follow-up is necessary. Dispose of the waste in a trash can, clean and disinfect the area, remove your gloves, and perform hand hygiene. Document the procedure in the patient's medical record. Include the date and time of the irrigation, the ear you irrigated, the solution, including the strength and the volume used, observations of the irrigated fluids, and the patient's tolerance to the procedure. Document any teaching instructions as well.